Hey everyone, welcome back. Today, we are diving into the GPS system of the human body. If you've ever been confused by words like proximal, sagittal, or supine, don't worry. We are breaking down anatomical locations, positions, and planes so they actually make sense. Let's get into it. Anatomical position. This is the standard body posture used as a baseline to describe medical and anatomical locations. Posture. The person stands upright and erect. Eyes, looking straight ahead. Arms, placed at the sides of the body. Palms, facing forward. Feet, kept close together. Supine position. In simple terms, this is the state of lying flat on one's back. Posture, lying face up. Arms, placed at the sides. Palms, facing upward, towards the sky. Legs, kept together. 3. Prone position. This is the opposite of the supine position. It is the state of lying on one's stomach. Posture, lying face down so that the face, chest, and abdomen are pressed against the floor or bed. Lithotomy position. This position is primarily used during childbirth or surgeries related to the pelvis. Posture. The person lies on their back, similar to the supine position. Legs, raised upwards. Support. Special straps or stirrups are used to hold the feet in the air. Primary use. Commonly used during delivery, childbirth, and for gynecological examinations. Anatomical planes. These are imaginary lines used to divide the body into sections, which is essential for anatomical study. Median or mid-sagittal plane. An imaginary line passing exactly through the center of the body. Feature. It divides the body into equal right and left halves. Sagittal plane. Any plane that runs parallel to the median plane. Feature. It also divides the body into right and left parts, but they are not necessarily equal. These can be thought of as lines running alongside the median plane. Analogy. If cutting an apple exactly through the middle is the median plane, then cutting parallel slices next to it represents the sagittal plane. Coronal and transverse planes. Coronal plane. An imaginary plane perpendicular, 90° circ, to the sagittal plane. Division. It divides the body into anterior, front, and posterior, back, halves. Visual. Imagine a cut going down through the sides of the body, by the ears. Transverse plane. A plane perpendicular to both the sagittal and coronal planes. It is also called the horizontal plane. Division. It divides the body into superior, upper, and inferior, lower, parts. Visual. Imagine a cut through the middle of the body, parallel to the waist. Directional terms for the trunk. These technical terms help identify the exact location of an organ. Ventral, anterior, the front of the body or trunk. Dorsal, posterior, the back of the body. Medial, closer to the midline, median plane, of the body. Lateral, away from the midline, towards the sides. Proximal, cranial, superior towards the head or the upper part of the body. Distal, caudal, inferior towards the lower part of the body or the feet. Superficial, close to the skin or the surface of the body. Deep, away from the skin, deeper inside the body. Ipsilateral, on the same side of the body, e.g., right hand and right foot. Contralateral, on opposite sides of the body, e.g., left hand and right hand. Invagination, a projection or pushing inwards. Evagination, a projection or pushing outwards. Example, the heart is medial to the lungs. Terms for limbs and embryology. Upper limbs, arms, ventral, anterior, front of the arm. Dorsal, posterior, back of the arm. Medial border, the side of the little finger extending up to the elbow. Lateral border, the side of the thumb. Palmar aspect, the palm of the hand. Dorsal aspect, the back of the hand. Flexor aspect, the front part that faces inward when the arm is bent. Extensor aspect, the back of the arm. Proximal, near the shoulder, root of the limb. Distal, away from the shoulder, towards the fingers. Lower limbs, legs, anterior, front of the leg. Posterior, back of the leg. Medial border, the side of the big toe, hallux. Lateral border, the side of the little toe. Flexor aspect, the back of the leg. Note, unlike the arms, the leg bends backward. Extensor aspect, the front of the leg. Proximal, near the hip. Distal, away from the hip, towards the feet. Embryology. Ventral, towards the belly. Dorsal, towards the back. Cranial, rostral, towards the head. Caudal, towards the tail or lower part of the body. Note to remember, in the arms, the flexor side is at the front, but in the legs, the flexor side is at the back. Be careful not to confuse them. If you ask why this topic is important, it's because the way we write exams or talk to others is very different from how an ordinary person speaks. If we include these words in our language, it creates a special impression. To put it simply, it lets you show off a little.